So peritonitis is the inflammation of the peritoneum, and peritonitis results from a localized or generalized inflammatory process of the peritoneum. So localized means only in a specific area, okay? And generalized means the whole peritoneum. So if there is any inflammatory process in the peritoneum, that can lead to peritonitis. And causes. We have two types of causes, the primary cause and the secondary cause. Blood-borne organisms and genital tract organisms. So what happens is when these blood-borne organisms and the genital tract organisms enter the peritoneal cavity, then it can start this inflammatory process and can lead to peritonitis and cirrhosis with ascites. So cirrhosis is a condition of the liver, okay, in which there is degenerative changes occur in the liver, okay, and as a complication of this liver cirrhosis, ascites occur. So, and ascites is the accumulation of fluid in the peritoneal cavity. So what happens when there is ascites is the fluid that gets accumulated in the peritoneal cavity, those fluid serves as an excellent medium for all these bloodborne organisms or the genital tract organisms to flourish there, okay? So that can result in peritonitis. And other secondary causes include appendicitis with rupture. The meaning of appendicitis is inflammation of the appendix, okay? So this appendicitis, if treatment is not taken in the right time, then it can lead to rupture. So this also can lead to peritonitis. And blunt or penetrating trauma to abdominal organs. Here the difference between blunt and penetrating trauma is that in blunt trauma, the skin in the abdomen will remain intact, okay? Just that because of the trauma caused by any blunt object, that can lead to internal abdominal organs injury, but the abdominal skin will remain intact in this case, okay? Whereas in penetrating trauma, the mostly by sharp objects, it will pierce through the skin of the abdomen and cause injury to the abdominal organs, okay? And diverticulitis with rupture. Diverticulitis meaning is inflammation of the diverticula, okay? And diverticula are the sac-like outpouching in the GI tract, mostly in the colon, okay? And obstruction in the GI tract. Mostly this intestine, large and the small intestine. And pancreatitis. Pancreatitis, it is the inflammation of the pancreas and perforated peptic ulcer. So peptic ulcer, in this condition, there will be ulceration in the mucosa of the GI tract, okay? And in severe cases, perforation can occur and this can lead to peritonitis and peritoneal dialysis. Dialysis is a procedure in which this is done when in case of kidney failure, okay? Most of the time in case of kidney failure, to remove the waste product from the body. And for dialysis, a semi-permeable membrane is required, okay? And we have two types of dialysis, hemodialysis and the peritoneal dialysis. In hemodialysis, blood will be totally removed from the body, and in outside dialyzer, the waste product will be removed. Only after that blood will be returned to the body, okay? And in case of peritoneal dialysis, a catheter will be placed in the peritoneum cavity, and in this case the peritoneum will act as a membrane, and here all the nitrogenous waste product and other waste product will be removed away from the body, Okay, and dialysis can also be done not only for the kidney failure, but when there is electrolyte imbalance, okay, like hyperkalemia. If hyperkalemia means high potassium level in the blood, okay, so this hyperkalemia, if hyperkalemia cannot be treated with other medical, like by giving medicine, then the patient can go for dialysis. And post-operative breakage of anastomosis. Anastomosis means suppose this transverse colon. Think of the transverse colon. So in the transverse colon, if there is a blockage in the middle, okay, and then there is necrosis, means death of the tissue, fibrosis. So those part of the colon is not required anymore. So if we cut and join the remaining two parts, then and that is called anastomosis. Okay, means connecting. Next is the pathophysiology. Okay, here causative factor means those organisms. Okay, it may be blood-borne organisms, all those, and then the secondary causes like rupture of appendicitis or the pancreatitis that can lead to inflammatory response. So as a result of those response, there will be massive fluid shifts. So fluid will be get shifted from the vascular space into the peritoneal cavity. So that is termed as a peritoneal edema. Edema means edema is the collection of fluid, okay, and then adhesion. Uh, Adhesion means scarring. This is uh, as the disease means as the inflammatory process keeps on going on, it will result in scarring of the peritoneum. Okay, and then clinical manifestation: abdominal pain.
Ma'am, can you please repeat the pathophysiology? Your voice
Okay,
was not clear, ma'am.
okay, fine. Causative factor. Okay, we have two causes, right? Primary causes and the secondary causes. So primary causes are those organisms, maybe bloodborne or the those urinary tract organism, and the secondary causes. I have listed down many secondary causes. One is rupture of the appendicitis. So all this factor can lead to inflammatory response in the peritoneum. Okay, and then because of this response, there will be massive fluid shifts. So fluid shifts will be from the vascular space to the peritoneal cavity. Means fluid, all your plasma, blood, they are present inside the vessel, right? So in this case, all those fluid will be moved out to the peritoneal cavity. So that is termed as peritoneal edema, okay? And then adhesions, it will lead to adhesions. Adhesions means scarring. So as the disease keeps, means as the inflammatory process keeps going on, it can lead to scarring. And then clinical manifestation: abdominal pain. Abdominal pain is the most common symptoms of peritonitis, and tenderness over involved area. Um I hope everybody knows what is the difference between pain and tenderness. Can anybody tell me the difference between pain and tenderness?
Ma'am, the infected area, it's become very soft and
Tenderness. Okay, fine. Let me tell you, okay, the difference between pain and tenderness. Uh, when you talk about pain means, when you say I have pain means, even suppose you are having abdominal pain, okay, so in that case, if nobody touch in your abdomen also, you'll be having that pain. That is the actual meaning of pain, okay. And tenderness means Like suppose you are just sitting there, but you don't feel any pain. But in case if you touch your abdomen and if you feel pain, that is tenderness. Okay, are you clear? Are you all clear the difference between pain and tenderness?
Yes,
Yes,
ma'am.
ma'am.
Okay, okay. And then there will be rebound tenderness, muscular rigidity, and spasm. So the medical term for this not medical term exactly. Okay, rebound tenderness is also known as the Blumberg sign. Okay, Blumberg sign. So what happened in rebound tenderness is suppose when the examiner gives pressure on the abdomen, the patient will not feel that pain, okay, or the tenderness, but the patient will get that tenderness upon removal of the pressure. So this is called rebound tenderness. And then there will be abdominal distension or ascites, accumulation of fluid in the peritoneal cavity, and fever, tachycardia means your high heart rate, and then tachypnea, increase in respiratory rate. This may be due to these are all due to the inflammatory process which is going on in the peritoneum. Okay, and then nausea, vomiting, altered bowel habit, and patient may lie very still and take only shallow respiration. Why the patient will only lie and take only shallow respiration is that when the patient moves, it can lead to more pain. So the patient, in most of the cases, will lie very still and take shallow respiration. And diagnostic studies include history and physical examination, and then complete
Ma'am,
blood. Hello. Yes, yes,
ma'am,
yes.
can you repeat that rebound tenderness?
Rebound tenderness means suppose you are taking doing the physical examination of a patient, okay, and you are doing palpation. Okay, palpation of the abdomen. In that case, for palpation, we need to give some amount of pressure to the abdomen, right, to palpate the abdominal organ. So when you give pressure and palpate the abdomen, the patient will not be having any tenderness. Okay, but soon as soon as you remove your hand from the client's abdomen, the patient will have tenderness. That is termed as the rebound tenderness. Are you clear?
Okay, ma'am. Thank you, ma'am.
Okay. Okay. And diagnostic studies, and then complete CVC is complete blood count. Okay. And then in complete blood count, what you will come to know is if the patient is having any kind of infection, then the WBC count will be elevated. Okay. And then serum electrolytes. Serum electrolytes include all those sodium, potassium, chloride, calcium, okay? And then abdominal x-ray. From abdominal x-ray, you can see the bowel, if there is any, or to see any rupture of the internal organs, okay? And then abdominal paracentesis and culture of the fluid. Paracentesis meaning is removal of fluid from the peritoneal cavity, okay? The meaning for paracentesis is removal of fluid from the peritoneal cavity. Means when there is ascites, means accumulation of fluid in the peritoneal cavity. But the thing is, uh, we don't need that fluid. So removal of those fluid from the peritoneal cavity is called the paracentesis. And after doing paracentesis, those fluid can be sent for culture to find out the microorganism causing the condition. Okay, and then CT scan or USG means ultrasonography. Okay, and CT means computed tomography. This is a kind of X-ray where you will get the 3D picture of the organ. Okay, so all this you can see. This can be done to see all the abdominal organs. Okay, as well as the peritoneum. And then let's come to the management part. Okay, collaborative therapy. Either we have preoperative or it is divided into preoperative and the postoperative. Preoperative meaning before performing the surgery. And for peritonitis, the surgery are mainly depend on the causes. Okay, suppose for example, if the peritonitis is caused by rupture of appendicitis, then the surgery that to be performed for the patient is appendectomy. Okay, so it depends on the causes. And in preoperative care means before the patient goes for surgery, the first is NPO status and IV fluid replacement, because there is shifting of fluid from the vascular space into the peritoneal cavity. So intravascular volume will be less and that can lead to hypovolemia, means low blood volume in the body. So for that purpose, IV fluid replacement should be given and antibiotic therapy for any kind of infection, and NG suction means nasogastric suctioning. Okay, and this is done to reduce the gastric distension. And we can also give analgesic to reduce the pain, and oxygen. Oxygen means here supplemental oxygen should be given if the patient oxygen saturation is less than 90%. Okay, and oxygen, as you all know, we can give by different methods like the nasal prong or your oxygen mask, and by different methods we can give and prepare the patient for surgery. And in the post-operative period, also right after the surgery, patients should be kept in NPO status, and nasogastric tube to low intermittent suctioning should be continued, and place the patient in semi-fowler position, and IV fluids with electrolytes replacement, and parenteral nutrition as needed. Okay, parenteral nutrition means I'll repeat again. Okay, parenteral nutrition means if you are giving any kind of nutrition in other than the GI tract. Okay, the most common is if you give through the vein. Okay, and antibiotic therapy should be continued, blood transfusion as needed, because during the surgery blood may be lost. So in that case, if the hemoglobin is low, then blood transfusion can also be given. And sedatives and opiates, these are to reduce the pain and anxiety of the patient. Okay, and complications of peritonitis include hypovolemic shock. Hypovolemic shock occurs when there is a less intravascular volume. Okay, and why there is less intravascular volume is because there is shifting away of all the fluid from the vascular space into the peritoneal cavity. And sepsis means infection. And then intra-abdominal abscess formation, paralytic ileus, a condition in which there is no peristalsis movement in the intestine leading to obstruction. Okay, and acute respiratory distress syndrome. So this is an acute and severe form of respiratory failure. Okay, and the acute respiratory distress syndrome in short form we used to say ARDS. Okay, so ARDS means acute respiratory distress syndrome. And then nursing management, nursing assessment, what are the information or the data that we should gather from the patient is, first, we have to assess the patient pain using that pain scale that ranges from 0 to 10. Okay, and then assess for presence of bowel sound. Bowel sound should be checked in all the four quadrants of the abdomen. Okay, and increasing abdominal distension, nausea, fever, and manifestation of hypovolemic shock. So some signs and symptoms of hypovolemic shock are like low blood pressure, increased heart rate, increased respiratory rate, and all these are the manifestation of hypovolemic shock. Okay. and nursing diagnosis. So these diagnoses are according to the priority. Okay, the most prior problem is acute pain related to inflammation of the peritoneum and abdominal distension. The second one is risks for deficient fluid volume related to fluid seeps into the peritoneal cavity secondary to trauma or infection. And the third one is anxiety related to uncertainty of cause or outcome of the condition and plan. So let's talk about this. The first nursing diagnosis, that is the acute pain. Okay, so the goal for acute pain is to reduce the pain. Okay, so and in intervention or the planning, first what we have to do is we should assess the level of the pain. Okay, and then after assessing the level of pain, assist the patient in providing comfortable position, and then provide a quiet environment to the patient, provide back massage, and administer the patient the prescribed analgesic like paracetamol, tramadol, all those. And after doing all this thing, you reassess the pain again. Okay, so these are some of the interventions to reduce the pain. And risks for deficient fluid volume related to fluid seeps into the peritoneal cavity secondary to trauma or infection. So in this for this nursing diagnosis, our goal will be to maintain the fluid volume. Okay, so for this, the first intervention will be to measure the intake and output. Okay, to measure the intake and output, and then we can also measure the abdominal guard to see for any fluid accumulation in the abdomen. Okay, and then if needed, IV fluids will be given to the patient. And anxiety related to uncertainty of cause or outcome of the condition and plan. For this, our goal will be to reduce the anxiety, and intervention include like first we have to assess the level of anxiety. Okay, and we should always reassure the patient. And how to reassure the patient is by explaining them about the cause and the what can be the outcome of the treatment being given to him or her. So we have to explain to the patient properly, and before explaining, we should always know the level of understanding of the patient. Okay, because level of understanding plays a very important. It's very important here because some people, if they don't understand, then you should make you should talk to them in a way that will make them understand. Okay, and after that, if we can also prescribe some sedatives to reduce anxiety, and later you reassess the level of anxiety of the patient. Okay, okay, so this is all. Any question